Let's talk about aortic aneurysm. It is a localized but pathological dilation of the aorta. May cause abdominal and or back pain, which is a sign of leaking, dissection, or imminent rupture. Again, what are we looking for? We're looking for localized dilation of aorta, which may cause abdominal or the back pain. So you would have an abdominal pain or the back pain. Pain is the major thing here. And when you have that, it is a sign of leaking, that this guy which you dilated is either leaking or there's some dissection into it or it has ruptured. I mean, if it ruptures, it leaks, or it dissects, it leaks. So anything is possible, right? So this is the aortic aneurysm. Aneurysm is the dilation. Here is it. Okay. So now let's look at two types. One is thoracic and the other is abdominal. Because if you recall, in the aorta you have abdominal aorta, you have thoracic aorta, right? And on top of that, you also have ascending aorta. So, but ascending here is combined with it. We will see that. So let's look at thoracic first. Thoracic, it is associated with cystic medial degeneration, high yield. CMD, cystic medial degeneration. Risk factors of this thoracic aorta is going to be hypertension, bicuspid aortic valve, connective tissue diseases, example Marfan syndrome. Also associated with high yield is tertiary syphilis, which is obliterative endarteritis of the vasa vasorum, and also aortic root dilatation may lead to aortic valve regurg. Okay, so these are all the risk factors for thoracic aortic aneurysm. While abdominal aortic aneurysm, it is associated with transmural, all the layers, causing inflammation. What was the top one? Let's just change color. The top one in the thoracic, we just said it's a cystic medial degeneration. Here we are saying it's not medial degeneration, it's transmural inflammation and extracellular matrix degradation. Transmural is the problem. What are the risk factors here? Well, the risk factors are tobacco smoking, increase in age, male sex, family history. Okay, may present as high yield, palpable, pulsatile abdominal mass, arrows in A. We can see arrow in A here, and if you look, you have a proper aneurysm that has been formed. Arrows in A point to the outer dilated aortic valve, for sure. Then you have the rupture may present as a triad. If it was to rupture, it's gonna give us a triad. What is the triad of pulsatile abdominal mass? Present as triad of pulse. So first thing is the pulsatile abdominal mass, acute abdominal or back pain. So pulsatile pain and hypotension. So 3 P's side of a thing, right? 3 P's. Pulsatile mass, pain, either the pain in the abdomen or the back, and P for hypotension. Resistant hypotension. Okay. Most often infrarenal high yield again. Where is the location? Infrarenal, which is the distribution of the vasa vasorum, where the distribution of the vasa vasorum is reduced. Okay, so Okay, so let's talk about some extra points for thoracic aortic aneurysm. What do we have? For thoracic one, this thoracic would also involve plus the ascending aorta. Okay, um, that's one thing. Other than that, we are going to see on chest x-ray, if we do for thoracic one, we will see, because the thoracic aortic aneurysm is just a dilation of the aorta, right? So we will see wide mediastinum, one thing. We will see large aortic knob canopy will be large, and we will also see tracheal deviation. In this, all the most important is wide mediastinum or widened mediastinum. Okay. On top of this, what we also going to see is with the tertiary syphilis is classically called as tree bark appearance of aorta. Tree bark appearance of aorta. Okay. And why did that occur? Because in tertiary syphilis, what's going to happen is that there is obliteration of the vasa vasorum. Now, normally vasa vasorum. So if you recall, here's all the so intima. Let's just in color. Intima, media, and adventitia. So intima does get blood supply from the lumen, the blood in the lumen, but the media is very thick, and it doesn't really get blood supply from there. So there are specific vessels called vasa vasorum which supply the media. Now in tertiary syphilis, you have obliterative and nauturitis of the vasa vasorum. And what is that? That is just that was supposed to give the blood to the media and adventitia. Now because it's an obliterative and nauturitis to the vasa vasorum, which causes decrease in blood to the media and adventitia, causing the weakness in the wall, which causes aneurysm formation, dilatation, right? Aneurysm formation. So that's the thing behind your tertiary syphilis. Other than that, you have also one. Let's just talk about this also. A yield point. That is about that in aortic root dilatation. So this is aortic root. If you recall, when you dilate the aortic root, you can have, so if you recall, you have left ventricle and aorta is just coming. When you dilate the root here, it's going to cause the valve to open up as well, leading to aortic regurg, right? And also it can, because of this aneurysm, which is dilatation. In dilatation, we can form thrombosis. Thrombosis can occur at any dilation, which can lead to even embolism of that thrombosis. Because we have mediastinal, a widened mediastinum, meaning it's going to take part in mediastinum, right? It can compress the mediastinal structures. So it can compress mediastinal structures. Which mediastinal structures we're looking at to compression? It can compress the airways or the esophagus, airway or esophagus, leading to either hoarseness or dysphagia, right? Or it can rupture, and rupture can be leading to severe pain and hemodynamic instability. And this is all for the thoracic one. Let's look at the aortic one. What are the extra things for aortic? Abdominal aortic aneurysm. So some extra points are that it is associated with atherosclerosis. Because if you look at all these risk factors, they are associated with atherosclerosis. So abdominal 1A for atherosclerosis. It is associated with atherosclerosis, which leads to transmural inflammation. Okay. Uh, Now, important thing in these patients are that you have, they can rupture, right? And all of this aneurysm can rupture. And with this rupture, because the aorta is a big vessel, large artery, right? So it can lead to sudden severe abdominal pain plus shock. Shock will be seen in these sort of patients if they rupture, if it was to rupture. Or if it doesn't rupture, still it's a big mass. Right, let's just dilate this. It's a big mass. So if it doesn't even rupture, still it's going to compress the structures nearby. For example, it can, in the abdomen, you also have ureters. If you recall from the, is it in renal or repro? But you have ureters. And this abdominal aorta, it's a near a proximity to the ureters. So if you have a dilation here, it can obstruct the ureters. Right, one of the things, and the other thing could be because of that, you can also have dilation can cause thrombosis and embolism. Okay, so yeah, that's what we have for abdominal aortic aneurysm. Looking at this picture on the right side, what do we have? Ascending thoracic aorta, aortic arch, and descending thoracic aorta and abdominal aorta. Fusiform, you can see the whole thing is just dilated, or saccular, and just one side is dilated. And if you look at the location of abdominal aorta, is below the renal arteries. So most often infrarenal, that is what they were trying to say. Most often it is anything that you see infrarenal, you will think about abdominal aortic aneurysm. Anything above is just thoracic. Thoracic also includes your ascending aorta. Okay, let's just recall the whole thing and move it on to next. So what do we have? Aneurysm is just the localized dilation that can cause pain either in the front or in the back. If you have a pain, that is the sign that you might be leaking from that aneurysm, or there's a dissection of that aneurysm, or there is imminent rupture can happen. There are two types. One is thoracic and one is abdominal aortic aneurysm. For thoracic, all you're looking for is cystic medial degeneration. Where? Just the media. There's a degeneration of the cystic medial degeneration. With the abdominal, you're looking at transmural. All three layers have inflammation. Risk factors for thoracic, because you're looking at medial degeneration, it's a connective tissue problem. It's hypertension, either the bicuspid connective tissue, or maybe you can call it more like congenital thing other than hypertension. So hypertension, bicuspid connective tissue, and torticephalus or aortic root dilation. With abdominal aorta aneurysm, you're looking at your cardiovascular risk factors, your hypertensive risk factor, for example, tobacco smoking, increased age, male sex, family history. High yield is this guy, abdominal aorta, is going to present with a triad. What is that triad? Pulsatile abdominal mass. So pulsatile mass will be there. Pain will be there. Hypotension will be there. And most likely it is going to be infrarenal. And that is all for aortic aneurysm.